to call to order the Middletown Board of Health meeting for Tuesday, January 10th, 2023. Amanda, can you call us, or do a roll call for us?
Mayor Condrey?
Here.
Mr. Richmond?
Here.
Ms. Cash?
Here.
Ms. Sipsey?
Here.
Ms. Lawley?
Here.
Dr. Patrick?
Here.
Mr. Bonnell?
Here.
Dr. Zollett?
Here.
Wow, we're all here. Great. Well, welcome to the new year. We've got 3 new Board of Health members, which is exciting. Some fresh blood. Do you guys mind introducing yourself?
Just say new.
Yeah, okay, we'll call it new. Some more fresh than others. That's okay. Do you guys just want to go down and just give us a little intro about yourself, and we can kind of do the same? I think it'd be helpful.
Sure. My name's Amy Sipsey.
And Amy, you're in the health and fitness?
Correct.
Okay.
Yeah.
Are you with
I
Power
own the
Station
Power
Gym
Station
by?
Gym out on
Okay.
Dixie Highway.
Awesome. Good to have you.
Thanks.
My name is Joe Richmond. I've been a Middletown resident my whole life, so I work in health insurance, wellness, health education specialist. So that's why I'm here.
Nice.
I'm Dr. Scott Zollett. I'm retired. I'm born here, lived here, was on the staff at the Atrium or the old Middletown Hospital for 40 years, I believe. And so that's it. I was in practice with my brother.
Great. Well, we're happy to have you.
Jeff Bonnell, I'm the funeral director here in town.
Ken Patrick, and I'm a retired veterinarian.
Sally Cash, retired RN.
Ruth Lawley, lived in Middletown my whole life as well. I do outreach, community outreach for an addiction treatment center here in town.
I'm Nicole Condrey. I'm the mayor. I have no background in the health, but the president of the Board of Health comes with the job of the mayor. So I rely on you guys for that part. My day job is I'm the general manager at Start Skydiving, and I jump into stadiums as a skydiver for my day job. So, yeah. Staff, do you guys want to kind of go around and tell us who you are too?
Yeah, and I have met the new board members, and it excites me, as I have told them, and as I've told you, the health board really needs to fit into the health mission, and you all do. I love the proactive health aspect that you bring. I love that you bring holistic health for job sites, right? Because Joe does a lot of things for wellness and organizations. And then you can measure our health, being a doctor. I laugh. But then Dr. Patrick also is a veterinarian. We do a lot of zoonotic illnesses. Jeff Bonnell is with a funeral home. We often talk about in our planning mass fatalities, and we need to know how many funeral homes have crematories and all of that wonderful stuff. Jeff has all that information. Sally can still do vaccinations and help us with all of her expertise as a nurse, and she was also a school nurse, and that's a big opportunity to know what's going on in your community as far as health. And with Ruth bringing up the rears, not last but not least, because she has the mental health aspect and addiction and the abuse, substance abuse or whatever that we're dealing with constantly this last probably decade. And so, yeah, and so this is an excellent board to measure all of that and help with all of that. So welcome, welcome. Amanda?
I'm Amanda McDonald, and I am the Vital Statistics Registrar, and I'm also the administrative assistant for the environmental, so all of the licensing and all of that I help Carla with. And I get everything ready for the Board of Health, so if you guys ever have any questions or you need anything, or you're not gonna be able to make a meeting, or any special circumstances, always just get a hold of me and let me know, and I will help in any way.
And I am Carla Ely. I am the Environmental Health Director, and I've been with the city for 25 years.
Yay.
Is that all?
I'm Chandra Corbin. I'm the Director of Nursing. I've been here since COVID started in 2020. Timing is everything.
Great timing.
I thought I'd touch real quick also on the, if you're not able to come to a meeting, technically per the charter, if you miss 2 meetings in a row that are unexcused, you can be removed from the board. However, if we know you're not gonna be here, we can vote to excuse your absence, if you know what I mean. So don't over stress about that part, but just make sure you let Amanda know so that we can know that you're just otherwise preoccupied and not just, ditching us, so. So, cool. All right, I highly encourage people, this is not super formal, so if you have something you wanna add to the conversation, we would love to hear from you at any point, so just speak up. We're a friendly bunch. Okay, so that brings us, to citizen comments. We have yet to have a citizen comment since I started here a little over 3 years ago. I'd love to have citizens in the meeting at some point, but we don't see them often at 7:30 in the morning, so. Do you have any citizen comments?
No, and we also need to say, we are being taped.
Oh, yeah.
We are, all of our board meetings, and I do believe almost all of the board and commission meetings, but I know ours is on YouTube afterwards, and so you can find us on YouTube, so.
Which is also good to push that message out, because it's good for people to know. So it's a positive thing.
Mhm.
Okay, next we have approval of minutes. So do we have enough of a quorum for the people who were at the last meeting to vote and those who weren't probably to abstain? I think
Yes.
so.
Yes, we do. Mhm.
If
Four
it's
here.
obviously how you feel comfortable, but if I wasn't at a meeting, I probably personally would abstain from approval of minutes. So you're welcome to abstain if you wish. I'm not gonna tell people how to vote for sure. But how we do this is someone will make a motion, someone will second the motion, then we'll say all in favor, aye, all opposed, nay. If you wish to abstain after we make the motions, you can just say that you wish to abstain. It doesn't happen almost ever, so I'm kind of thinking in the Board of Health how we would do that, but that would be fine. We don't have to overthink it.
It's about to happen.
It's
I wasn't here last.
Oh, you weren't either. Oh, then we don't have enough of
Oh,
a
do
quorum to
not.
approve them. Then,
Well, I'm
If
trying to think, 'cause
somebody
you
can-
usually can stand in as a vote. if
Can
they
I?
say- Yeah, I'm almost positive at the end. 1, 2, 3, 4 of you, so I don't think it was anything controversial other than our budget. It's up to you, whatever you feel comfortable with. What do you think?
Ruth, did you look over them at all to feel like,
I looked over it, yeah.
then if you'd be willing to at least say that looks like things that we would, I don't know.
Well, we can approve them all on this, if you want to wait until February. If you want, we can do January and
I
February.
mean, the only
such as
thing
holds
that's
us
gonna
up.
gain us is somebody reading them more, right?
Right.
Because we don't have more
Mhm.
people.
But when people are absent, like at a normal meeting, they
Yeah.
still vote on the meeting minutes, so since
Oh,
Ruth
do
is
I?
a
Okay.
current member and she's read them.
She can,
Yeah.
yeah, it's not like she can't.
I can?
Yes, you can,
Oh, okay.
yeah.
Yeah.
Well, then we'll go for
Okay, great.
it. Okay.
Do we have a motion to approve the minutes from December of 2022?
So moved.
Oh, she's bold.
Second.
Second myself. Okay, all in favor?
Aye.
All opposed? Did we have anyone abstain? We have 3 abstentions?
Yeah.
Okay, you got that on there, Amanda?
Yeah.
All right, great, let's move past that awkward moment. Okay. Next, we have receive and file the financial report for December 2022. So this is merely reviewing the financial report from the packet, saying, yep, that looks good, I don't have any questions. Before we have any motions, do we have any questions about the financial report from December 2022? Okay, do we have a motion to receive and file the December 2022 financial report?
So moved.
Second.
All in favor? All opposed? Okay, all right, your first official Board of Health vote, congratulations. Moving on, all right, we got an education presentation, the history of public health in Ohio. Who's doing that today for us?
Chandra,
Chandra, all right.
we thought it was a good presentation for the beginning of the year, especially with our new
Yeah,
board members.
so every meeting we get some sort of a presentation, we get to learn something new about health, which is exciting. I imagine if you have any specific requests, Jackie and team would be happy to take them on board.
Absolutely, at any time. Are you able to move it, Chandra? You got it? Amanda can do it for you too, if she.
I was gonna say, all it did was blow it up. Okay, so, according to the Institute of Medicine, definition definition of public health is a coordinated effort at the local, state, and federal level whose mission is fulfilling society's interest in assuring conditions in which people can be healthy. So it's about as generic as you can possibly get to say public health is involved with all aspects of health. So for Ohio, a little bit of history is before 1919 and before, smallpox epidemic in 17 and influenza epidemic in 18, townships and counties and cities and random municipalities could have health departments or health districts, health units, and there was no real rhyme, reason, standard of practice for those health units. And as you can see in red, there were 2,158 prior to 1920 in Ohio. So as a result of the pandemics, legislation was passed that kind of built those standards, those minimum standards of what a health department should do for their public. And as a result, it went from the 2,158 in 1920 to basically 100 years later, we were down to 113 in Ohio. And there's 88 counties. So each county has at least one health district. The difference there is when you have the municipalities who have independent health departments, such as Butler County. Butler County has the city of Middletown, city of Hamilton, and Butler County as a health department. So we have 3 here in Butler County. We work in conjunction with the Southwest region of Ohio, which encompasses 13 health departments. Those are all listed there, 8 counties and 5 cities total. Hamilton County has 3 cities and, 3 cities and a county health department. So they're just a little, they outnumber us by 1. So in that legislation, minimum staffing standards were set. A Board of Health had to be established. Thus our governing body. And then what they call the public health triad. A health commissioner, a director of environmental health, and a director of nursing all have to be employed to qualify as a health department. And if the health commissioner is not a doctor, the Board of Health must employ a medical director as an advisor.
So we have health commissioner, environmental health, nursing, and then Dr. Genowine will join our meetings. Sometimes he's kind of like a liaison to the health department. Is that how you would?
Yeah,
I mean,
and he's the number
officially
one, the official consultant, so you have to have a medical doctor to sign off on all your standing orders. And so
Okay.
when we do flu vaccines, any kind of medical procedures type things, you need a medical director to do so.
But he doesn't work in the city building every day.
No.
He's just comes as needed, right?
Correct.
So, boards of health and health departments all have to follow the law. It's written in Ohio Revised Code and Ohio Administrative Code. It gets down to the nitty-gritty of even requiring trainings for the Board of Health. Thus the reason you will get an educational presentation at each Board of Health meeting. That's a requirement in code, as well as conference attendance by our health commissioner, by a medical director, or their designees every year as well. And that's, kind of the nitty-gritty of it. Of course, those codes also dictate licensing and things like that as well. So our overarching, goal for public health is to prevent, protect, and promote health in all aspects, from disease, injury, behaviors, and responding to emergencies. So if it involves our community, we want to be involved in it. This is a little bit of what we do specifically, core services. The environmental health, which is under Carla, they do the retail and food service inspections and licensing. There's roughly 315 current establishments that they have to regulate. Septic systems, as well as private wells here in the city. Body art campgrounds and swimming pools, those all have to be licensed. Schools have to be inspected. Rabies investigations, which is pretty much any animal bite that is reported. Those things are unfunded, but expected for us to do. Emergency preparedness, and that includes anything from pandemics to floods to tornadoes to pretty much anything that could impact the health of our residents. Ohio Smoke-Free Workplace, which is any of those smoking complaints at restaurants and bars. Our environmental health specialists go out and inspect those facilities, check on complaints, and then educate those facilities on what the law is about smoking indoors. Our environmental health also has to do all of the plan reviews and follow-ups on those for any of our new restaurants or food service establishments that are opening up here in Middletown as well. This is a map of the septic systems in Middletown. You will hear more about septics throughout the year. Carla wanted to kind of show you the pockets of town that have the majority of the septic systems. That's all in red.
We had an education presentation on this a couple months ago that may be worth you guys going back and watching that one, because it is kind of a big deal with the Amanda neighborhood. So if we can find the link.
We gave them that information too.
Yeah.
And when we oriented them, when I spoke with them before,
Okay.
I had told them we may be in the world of septics this year, so
Okay.
to familiarize themselves with it. But surprisingly, they knew about septics. And, some people don't know anything about septics.
Cool. Okay.
So they do
Sounds
have
good.
that, and the educational part, I explained to them that Janae showed us what it
Yeah,
looks like, a
it
big
was
one or
good
whatever. And
presentation,
yeah. And this is kind of just that map we were talking about. You can see where we were talking about that Amanda area. That is really heavily populated with septics, and then scattered throughout the city. Thanks.
So the nursing division, I do all of the disease outbreak surveillance, tracking, and reporting. Immunizations, there's the totals of immunizations that were administered in 2021 and 2022. Obviously, COVID vaccinations were huge in 2020-21 and have greatly tapered off in the last year, but we are still offering those. Children with Medical Handicaps program, we have roughly 100 children enrolled in that program, and we are working on contacting all of those children and making sure they are getting the services that they need. Administrative division is health promotion and education. Laura, who works in our front office with Amanda, does an amazing job of putting out health promotion materials on our front door, in our flyer bins downstairs and upstairs and around the building. She does at least a monthly topic, as well as putting out other information throughout the year. Vital statistics, we do all of the birth and deaths for the city of Middletown. And there were 2,103 records filed last year. So they were busy. And then public health accreditation is an ongoing venture for us. We became accredited, received our national accreditation on November 4th this past year. So you will get updated on that periodically, as well as we continue to meet those standards. How is public health funded? Primarily locally, out of government dollars. And we do get federal and state grant funding, so as grants, get either passed through on a county level, or we apply for or partner with other agencies for grants, you all will hear about those, and get your, feedback and input on those as well. And then there is a state subsidy, again, in Ohio Revised Code that says that we have to meet minimum standards, in my administrative code, I'm sorry. That says we have to meet, minimum standards that we have to report to the state of Ohio every year, in an annual report, and, then they will give us a, subsidy, which is not a whole lot, but it still, shows that we are doing what our minimum requirements are. And then, we just appreciate your support, and if you have any questions, please feel free to ask. That's just public health in a very small nutshell.
Can you guys describe how the Department of Health differs from the other departments in the city as far as administratively, because it is different, right?
It is, public health, you said between us and the other departments?
Yeah.
We are our own beast, if you will. So we are, the mayor, of course, is informed on everything. That's why I think mayors sit on the public health board, because they can funnel everything back to their counterparts, right? Because the mayor and the council does not hire and fire me, the Board of Health does. And so I think every other department in the city, other than municipal courts, they're kind of just like us. They stand alone as well, because they're governed by a different body. But if something were to happen with the other departments, it goes up to the city manager. With the Board of Health, it comes to you guys. And so that's why we're just a standalone. We're legally mandated, because if you're gonna have a Board of Health, you have to kind of follow the Ohio Revised Codes and that kind of thing. So it kind of stands alone. We're official board too. So it's not like we can't have minutes. It's like we cannot not meet, you know, that's a double negative, but because you're officially having to do the business of the, so that's a little different than a board and commission, because we're like official law regulated board and commission, and we also are put in by our charter. So when we meet for charter review, they can do something different with the Board of Health if they so choose, but that's where we're actually mandated through there. So that's how we say how many members, all the rules and regulations is from there too, so. Does that make sense?
Whereas all the rest of the boards and commissions are only really beholden to the Middletown city charter, the Board of Health also has to answer to the Ohio Revised Code at large.
Absolutely, right.
For what that's worth, you can look up ORC, Ohio Revised Code, you'll see references to it all the time. If you're not familiar with it, there's a lot of great information in there that answers my questions all the time when I go to
I know,
look in there, so.
it's crazy. And also, when she was saying how we're funded, we also have revenue, and that's our licensing that we're funded by. And when we do some vaccines, we get funding that way, so we get some money that way. And it's my understanding, and we'll see, because that leads into the next topic, FAB, once you're accredited, you're supposed to get more state subsidy. That was another carrot that ODH said, that funded health departments receive more money than non-funded. Accredited health departments receive more funding than non-accredited. That was another encouragement for people to get accredited. So we'll see how much that, and the grants and et cetera, it's supposed to be a different percentage.
Anybody have any questions about Department of Health or Board of Health, kind of role, responsibility? We're covering most of the types of things that we do for the most part in today's meeting, so kind of a good overview of that.
Yeah.
Okay, well that brings us to old business. Speaking of which, septic systems.
Carla, did you wanna just, I think, I do believe, and help me out, Nicole, I do believe we were wondering exactly kind of like how many there were still, and we're just touching base on it. We did already inform our new members that we may be embarking more on this, and so I didn't know if there was anything more to talk about, or you did mention it to council.
I did, yeah, I brought it up in the 2 council meetings ago
Okay.
to inform everyone and make sure they're aware, like, hey, something's gonna have to be done with Amanda specifically. And I read into the record the abbreviated
Summary
synopsis that
we
you guys gave me, which was very helpful, thank you.
Anything else, Carla?
Nope, I think that's pretty much it, with as far as the numbers, did you wanna go over the numbers we have, that are there?
Because they were there.
Yeah, I think the big thing is there were 424 in that Amanda area for septic systems. We have a total of 690 total septic systems within the city, and the remaining are just throughout the city, so it's just.
So the issues in Amanda
Amanda
is
area.
that they're in a floodplain, the lots are too small to put in
Right.
appropriate leach
They
fields,
could be-
is that the term?
Right, right.
I'm working on it. And then,
Yeah.
and so really, it's cost prohibitive to fully connect to sewer in the proper way. Is that the,
That's correct.
essentially?
Mhm.
So we have to at some point figure out what to do, because it's been too long. Now, every time it floods, we don't know what's floating,
Mhm.
if you will.
Right.
So and it's been like this for a long time, and
Mhm.
I think something that raised my eyebrow during the discussion was that you guys actually said we have we have some sort of actual responsibility
Mhm.
legally to do something as well, correct? From
Yeah,
a health
yeah,
perspective.
public health,
I mean,
yeah. Yeah.
obviously, we know we want to do something, but there may be a legal ramifications like pushing us forward on this
Mhm.
matter sooner rather than later. I feel like we need to either have a working group or something has to happen. Like, I feel like there's no
Right.
next step identified yet.
Well,
And
I
that has me a
spoke
little-
yesterday with city manager, because this is the new year, and we're talking about capital improvements and whatever. And so I just sent a little tickler again to Public Works, Scott Tadish and Paul Lally. We need to talk about septics, and Scott agreed. Scott said, I agree.
Okay.
So that will maybe start the ball
Good.
rolling as far as some kind of
Yeah.
attention, I guess, because the plan is gonna be a very big plan, whatever the plan will be, because it will, even if we have a plan that we're ready to, if it's an emergency, we're ready to implement or something, you know what I mean? But it's gonna be, it has to be comprehensive and whatever. And we talked a little bit about this, we had a good discussion with the newer board members, because that's public health, sometimes you have to do things that are not very popular, or at least you have to bring attention to the things, right? And then the people may decide, it would ultimately, I do believe, the Board of Health can always push city council, but city council is the one that would have to kind of make the big decisions, what to do, because it would be funded and, it'd be that
Right,
kind
out
of
of
stuff.
probably
So, yeah.
Public Works in some fashion.
Right, yeah, definitely, and that's a good place to,
Yeah.
because it's more of a flusher fund, per se, for those kind of activities.
Pun intended.
Flusher, no pun intended, yeah, see, I'm not quick enough. So, yeah, but it's kind of exciting as much as I love and hate conflict. It's kind of exciting, because you need to, sometimes you just need to
You have to resolve it. Yeah.
resolve it, yes, exactly.
It's kind of like one of two directions, right? One, we dump a bunch of money into connecting them all to sewer
Mhm.
as a city, because the homeowners don't have the money. I mean, it's
Mhm.
kind of that,
Right.
or we look at over time, moving people out of the area.
Right.
And what that looks like is obviously is definitely controversial and
Mhm.
scary, and how do you do that? But there are other environmental issues going on in that neighborhood that may also dictate
Right.
the way forward, as well, with Suncoke being so close, and we get complaints a lot, whether they're founded officially and have data behind them to say that they are actually problems is another.
And it could be the third one too, right? Both, because we
Yeah,
may need sewers while we're moving people out. It could kind of snowball where everything's happening at the same time, because you just can't
Yeah.
move people on a dime, so it might be all about, yeah.
Great.
Where do the funds come to do this?
That's a good question.
From the heavens. No, I do believe that there's probably multiple places that you could bring funding from. It would be from a sewer fund, it could be from EPA funds, it could be from city funds, it could be, you could probably pool a lot of funds together, but it would
CDBG may
ultimately,
have something
yeah.
to do with it too.
But it won't cover all of it, I wouldn't expect, would you? It would be probably too big of a plan to cover all of the funds, but we could definitely have,
I think it's gonna be it would have to be
Multiple sources.
paths,
Yeah,
yeah.
Christy Durich's plan
Mhm.
that she discussed with us the last meeting, could any funds be connected to that?
yeah. Absolutely, I think some of the educational pieces, because I think it's gonna be a large project if it was, so, I think we could get, like you said, multiple sources that would definitely fit into what we're doing. but the heavy lift would probably be EPA grants and the sewer fund.
It seems like before that, whatever discussion occurs, somebody needs to say, here's how much it would cost to get everybody on sewer.
Absolutely.
Well, the
And
other
then
thing
bring
is
that.
where are you moving them? There's no housing.
Yeah, I mean, all of that would have to be taken into account. And I think we looked at those when we first started talking about that, you know, cost keeps going up. But it was always a $3 to $5 million project. And so, and now that some houses are on, I mean, for sewers, I think that's what, so now that some houses may have been on, or some houses may be exempt, it may change a little bit, but I think Scott can get us those numbers closer, you know,
Yeah.
closer,
Mhm.
the public health director, so. So we will not, we'll make sure, I promise the board, we will keep it on our radar every month to see where we're moving, so we won't get to December and say the same thing we're saying now, January. It's important, we need to, you know, at least say we're not doing nothing, or we will definitely have some kind of, you know, plan started, and keep the council informed, and I like you're doing now, so.
Thank you, guys. Okay, we'll move on to FAB.
Fab,
Any
yay!
updates there?
You have this letter in the packet congratulating us, and I'll pass this around. This is such a beautiful plaque. Yeah. Amy, you're gonna like that. It's a good weight. It's a, so that is your official
Beautiful.
plaque that is hanging in the office, and we are embarking, as everyone knows, another community health assessment. We're starting over with accreditation piece, because we have to start every 3 to 5 years, do assessment, so that's starting actually tomorrow. And so we had board members involved in our community health assessment in the past. If any board members are interested, I think we sent out an invite. Some of you should have received the invite that it was tomorrow at the ESC, and that's in Hamilton, 400 North Erie Street in Hamilton, but we will keep you apprised of it. You could come in and out of those meetings, but it's just, we bring all the agencies and people together as we're gathering data again about what we need to improve, what health indicators we need to improve on. And it appears it's probably gonna be the same 3, because it hasn't moved the needle a lot, and it's gonna be substance abuse, mental health, substance abuse is 1. Chronic illness, heart disease, diabetes, that kind of stuff is 2, and infant mortality is the 3rd one. And so we're hoping to look at new innovative ways to start moving the needle a little bit with those things. And so we're gonna be challenging all of our agencies and people, what can we do a little different to make a difference? Did things work that we put in last, 3 to 5 years ago? Because after we do our community health assessment, which we call CHOP, it's a whole lot of acronyms here, community health assessment, we have to follow that up with a community health improvement plan. So once you assess, you have to make a plan. And so, to be continued, so as we start talking about this, we'll put things in the packet so you guys can have a look at it and see if you have any additional things to add. As well as I had spoke with, my report is probably gonna be throughout this meeting. I had spoken with Joe when I met Joe the first time, and I said, we're looking at, and the mayor witnessed this yesterday, we're looking at wellness plans within organizations, why they're not more utilized and why people are not taking advantage of those things. And I also spoke with Amy when we were meeting, saying, I said, when did you get involved in health? And she said she's been in it all her life, because the history of the power station being in the family. And that kind of made an aha moment that we may be trying to change people too late. We might be trying to, we may need to start getting men and women health, prioritizing the health at 12, because you said you started around 12, 13. So start getting people before they become adult, before they get busy, before they get set in their ways, before they get pre-diabetic, you know. So it was just interesting jogging those things in my memory. So I mean, like I said, I think this is a new year that we can start doing things a little differently, so. But thank you, everybody on FAB. I'm gonna try not to talk about FAB, but it requires us to keep it on the agenda. So how did you inform your board? What are you doing? So,
Got it.
yeah, so that's why we're just we'll keep you updated on all the things we're doing.
I had one other old business item I wanted to raise. I saw in the newspaper, it talked about Hamilton having, like, putting their tobacco 21, the local licensing on hold, possibly, because there's a state legislative item that may veto
It was
the
vetoed.
ability.
It was
The
vetoed.
legislative item was vetoed, or the local one was, ability was vetoed.
I do believe, and I'll double check with Christina, but I do believe the governor vetoed remember they were trying to make sure that locals were not able to legalize so he vetoed that, so locals
Okay, so
still
we
can.
can.
Still can
Somebody
now,
double
we
noted.
can move forward, yeah.
Okay, we
I know,
can.
so we can
Yes,
still
I'm
move
part of it.
forward, yeah.
Yeah, I saw that, that had something
It was
with flavored tobacco, that's a different article from the one I had read, so,
Right.
okay.
Yeah, so, we're looking really closely, I do believe this, they're continuing, moving forward, so we will continue to move forward. Thank God, this year is our educational year, right, so we'll have a little more time before we put things in place that we have to
Okay.
remove, but this year, we're just implementing, the education of the facilities and et cetera. We would not start licensing until what did we say, Carla? When did, 24?
24.
Yeah, so we do have, I mean, it wouldn't
January.
disrupt our
Okay.
actually start and stop time, but,
So we've been involved in the
Tobacco
process of creating a local licensing program for the tobacco and vaping products in Middletown. So Hamilton is ahead of us on that by, about a year?
approximately.
So they're implementing this year the actual enforcement of it.
You're right.
What Jackie was saying is our focus this year is educating all of the businesses who currently sell tobacco and vaping products about the process. They pay, I don't remember if the fees have been set, but some sort of a fee, $200 a year, something like that.
Yes, $250.
No matter the size or the volume that they're selling, it's a certain amount if they want the license to be able to sell it in Middletown. And then the goal of it is to help enforcement of not selling tobacco to anyone under the age of 21.
Correct. And to try to get some kind of control over our vaping sites. The vaping sites have no regulation right now. And so that's why the governor was looking at flavored tobacco and that kind of stuff. You know what I mean? Because right now you can open up a shop, you can be a vendor and open up a shop and sell all this tobacco type of products, and you're not regulated at all. And every time they bust these sites in Hamilton, they're THC in the products and stuff like that too. And so you're just trying to get a little more regulation over that flavored tobacco, the vaping piece. Because that's what a big problem is with the young kids. Everybody's vaping.
Thank you for the impromptu.
Yeah, thanks.
Okay, so that brings us to new business. We have travel authorizations.
I don't think we have any.
Oh, we have none.
Nope.
Oh, okay, so sometimes we have travel authorizations. We just kind of say yes, go to the conference, get reimbursed for your miles and food, and that's kind of how that works. We don't have any today. Okay, let's move on. So we have a facility use agreement with Middletown City Schools. Do you guys want to speak to that one before we look to approve?
Yeah, this is, if you guys remember when we did COVID vaccinations on a large scale, we used Middletown High School, and we also used some of the smaller elementary schools. And so this facility agreement just says that in the case of emergency, we can use their facility. And we changed it this year, and Carla, correct me if I'm wrong, but we were approving every year. Now we're doing every 2, so we won't have to keep coming back to the Board of Education and to this board. So for 2 years, this facility will be in place. This would be for any mass, administration or mass vaccination, we could do antibiotics for anthrax. Anytime you have to do a mass blank, you need a big facility that you can do a big flow through, and you can have plans of how you're gonna run things. And we've tested this out, and it's a perfect place to do it. The high school has over 700 parking spaces. They have multiple doors that you can come in and out, and it was a great facility. We had this facility before at Miami University, but they built the new high school, and they've been great partners. And so this will come to you every other year, right? So.
As far as navigating the workbook for this, Amanda has done a lovely job of putting links in that first page. So if you're ever on the soft copy version, you can click on the agenda item. It'll bring you to that part in the workbook, just as a little tip and trick. Okay, so do we have a motion to approve the facility use agreement between Middletown City Board of Health and the Middletown City Schools?
So move.
Second.
All in favor?
Aye.
All opposed? Okay, motion passes. Next agreement is between Butler County General Health District and City of Middletown Health Department for the community health assessment.
And this is just agreement that all three health departments are working together to secure this facilitator and this initiator of the community health assessment. And so we divided the cost of this person by population. And I think it may be two people, because we're doing a community health assessment and community health improvement plan. And these two people will be helping us collect the data, facilitate the meetings, type up all the, you know, the plans, et cetera.
So Hamilton and Middletown are the only two with health departments in Butler County?
Yeah,
That's
that's three of
why.
us, it's Butler County, Hamilton, and Middletown, yeah.
Okay. What does Oxford do, or what?
Oxford is covered under Butler County. So Butler County is has a lot of ground. They have Westchester, they have Ross, they have Trenton, they have Monroe, they have Fairfield, they have Oxford. I mean, you guys could probably name more than
Yeah.
I'm. Jacksonville, they probably have Madison right across here, so they have
Yeah.
all of that, yeah. A lot of township trustees involved in theirs, yeah.
Okay. Do we have a motion to approve the agreement between Butler County General Health District and the City of Middletown Health Department for the community health assessment?
So move.
Second.
Any comments or questions on it? Okay, all in favor? All opposed? Okay, agreement has been approved. Now we get some fun annual things to do, right? We've got our Board of Health roster. Do we have to approve that?
Nope, you do
Okay.
not, it's just presented for you. We always, and I already checked with the new board members, but everyone needs to check this, make sure your emails are correct, your cell numbers are correct, just in case we have any
Do you
wrong
want to pass
spelling.
it around?
It's in, yeah, you can pass it around or
That way
put
if
it in,
somebody
yeah.
doesn't.
To check, yeah, just check it and then, and this is how you're gonna be notified. If, we love sales, I think almost everybody has sales, but we could text you if it's a cancellation at the last minute, so we try to, get in touch with you that way. But the best way to contact you on there is good. If you look at your emails, unless it gets buried, sometimes we get
We'll let
buried.
people look at that as it gets passed around and kind of keep
And we just
going.
need to receive it, we don't need to approve it.
But we don't have to vote to receive
Nope.
it. Okay. Okay, so the next thing is election of President Pro Tem. So this is essentially if I'm not at a meeting, which I know I will not be at the March meeting.
Okay. Oh, good.
There you go. In advance.
Make a note of that.
Yep. That this person can run the meeting and do all the things. So do we have anyone who would like to volunteer for the position before we? I'm just helping facilitate this
Right.
conversation at this point.
I
It's
would
really-
love to voluntold Miss Sally Cash, only because
What?
she was our pro temp for what, 1 minute, and then you were off the board, and you received your Robert's Rule of Order and everything, and you were all prepared to be the pro temp, and then,
Bet I'm not anymore.
right, so, because I would hate to put it on the three, so it's gonna be Dr. Patrick, Jeff, or Sally, because those are the oldest members. Something comes with you guys being the senior members. And really and truly, it's not a lot, you just follow, just like the mayor's doing, you follow, the agenda. She usually lets you know when she's not gonna be here. She is usually here all the time. I think you only was
Only
out
missed a-
once, maybe, once or
I think
twice.
2, maybe in 3.
Yeah, because you broke your arm maybe one time, maybe.
I had, no, I had my appendix removed.
That's it. She had
The
a
morning
appendix.
of the meeting.
Yeah,
That
yeah,
was the
right,
day.
there was emergency.
Yeah. Just
Unless
so the whole
anyone-
city knows now,
Right,
it's on
right.
public record.
Oh, yeah, but it's, we could have made it more interesting, we could have made something else more interesting. That's when we had the tummy tuck or the facelift or something like that. We
Oh,
could've made
yeah.
it more interesting
Yeah,
on
we
it.
could start some rumors.
Yeah.
Okay.
But, that's a good rumor to start. Like you say, mine failed, right? My tummy tuck failed. But it's just up to someone. I was just putting Sally on the spot, but Jeff or Ken or Ruth or,
Oh, no.
President Pro Tem.
they're over there
I
bargaining.
mean, Jackie will help you through the meeting for
Yeah,
sure.
That's it.
Well, if no one else wants to do it, I would be pleased to do it.
motion to nominate Dr. Patrick for the 2023 President Pro Tem.
Second.
All in favor?
Aye.
All opposed? Congratulations, Dr. Patrick, thank you for your service.
Thank you, Dr. Patrick.
Okay, the next thing we have are Board of Health committees. I don't know, aside from the Personnel Committee, has anybody ever met?
Well, no, we haven't. Now, I tell you, everybody has a finance committee because most public health departments have levies. And we do not have a levy.
Oh.
That's the reason why they usually have a finance committee. But if there was ever a time where we were gonna do strong cuts or whatever, a finance committee comes in very handy. Again, since our board is a little different, we do not have to follow the city's budget rules. If you guys ever wanna step outside of what the city wants to do, you guys could come up and decide to do anything and present it. The mayor's still involved, and then she knows it's coming, because the courts change their rules and pay schedules and stuff all the time. So we don't have to, but we've always been good players and followed those, city policies. But for some reason, if you wanted to do something different, you could. For some reason, you said, public health is underfunded, we want more of the budget, you can do any of that. So that's why the finance committee is still in place. Personnel committee meets, help me out, Mayor, twice a year maybe for my evaluation, I think.
Yeah.
Maybe the most.
We meet like one meeting, we do an executive session to talk about Jackie. Do the evaluations together, and then the next meeting is, I'll compile it, and then we meet with her and do feedback, so.
Yeah. So
And
it's-
often the rest of the board participates in that anyway, because it's really not,
It's so easy.
yeah, it's kind of, we, as a personnel committee, say, if we all agree that we would like other board members' input, then we often invite them into the executive session, so.
The mayor sits on both committees, so the mayor is the starting point of the committee, and then Dr. Patrick, you were on Personnel Committee, and Jeff Bunnell was on Personnel Committee, and Ruth you're both on, and I didn't know if you wanted to get
How many
shift
need
off.
to be on that?
I think you just split them up, and it's odd number each way, so.
Okay, so
yeah.
everyone ends up on one or the other?
Everybody ends up on one or the other, yeah, and the mayor's on both. So you can let us know, I'll have Amanda send out a email, and you can let us know which one, and then we'll appoint them next time on the
Okay, yeah,
committee.
that's fine.
And so you'll get this next time, okay? And that'll be easy enough, just think about if you wanna be on the finance one, I don't know how busy anyone is, but it really is really simple,
I don't think it's ever met.
yeah.
That's the
We,
finance.
2011, I think 2011, we went through
That was the
11.
right answer, but-
Yeah. That's the right answer, finance committee?
Yes.
So- That's it.
Okay, then we've got our 2022 fourth quarter report.
Yeah. You get quarterly reports in your packet, and we try to put all our disease reporting and our inspections for a quarter in there, so you can kind of look and see what we've done, as well as compare it to the, previous year. Thank you, Dr. Patrick. I think you can have it.
Thank you, President Pro Tem.
So do we vote? We don't vote on this, do we? We just put it in the packet, it's just your, it's
So if
just your
anyone has
comparison.
questions about it,
You guys will be more familiar with all of this at the next quarter to the look. At any time, jot down any questions that you may have through this whole process as well.
I'd like to add a new business item to each of the meetings, and that being like a standing Board of Health member item. So if people have anything that they want to bring up as new business to the Board of Health, I mean, you guys are in the community thinking about health all the time, and I feel like I would like to see our own board members be able to raise topics and bring it, just like, kind of keep it in our minds, and if there's something you want to raise, we've got a kind of standing.
Do you want that?
We added that to
maybe?
council, and I really like it, like, we often will bring something up, and it keeps you thinking between meetings of stuff that you probably
bring
think
up.
could be, yeah. So
Where
we
would you like
just-
that placed?
Maybe
Open
in new
discussion
business,
or new
yeah, in new
business, or-
business, we just add something to the end that's like Board of Health member
Yeah,
topics or
okay.
something.
Okay, yeah, board topic?
Yeah.
Open discussion board? Okay.
These people have very important things that they're doing in the community that I'm sure they're coming up with. Yeah. maybe you'll never have anything, but you never know. I see in Ruth, Ruth's gonna have some. Okay, so that brings us to reports. Health Commissioner, so Jackie's been doing, giving us some notes for these in like, when we get here, so probably she's gonna go through that with you.
Right, and if, that's just a handout, if you have anything that you want me to, like, expand on. The only other thing is, we are still meeting for that One Ohio,
Yeah,
yeah.
we signed, something
As a group of mayors?
requesting that Butler County
Yeah,
be
pulled out.
siphoned off into its own region, which I will be surprised if they do that. However, at least we asked for it.
So this One Ohio money is opiate, money that, from the, do you guys remember all of this? The drug companies were sued and we won money and we have millions of dollars and they're trying to structure it out, how it's gonna be spent by affected counties and cities. And so we are still kind of debating on that. I don't think any money has been spent yet, and so
Are
we're.
there timelines
yeah.
for that? There are, right?
It is timelines, but they're like 24, 25.
The money is dispersed over 15 years.
18 years, yeah.
But doesn't, I don't know that there's spending requirements on it, which is
Well,
interesting.
and when I met with that lady in Columbus, attorney in Columbus, she said that the foundation board has not even formed because, thank you, Jeff. The foundation board hasn't even been formed because the foundation board has to be, it has different rules. I guess like when you're at the foundation, you have different spending rules. And so it looked like a lot of, funding came down and it was like a cart before the horse before all the structure was even set up.
Which we knew that was
Yeah.
gonna.
So, to be continued, but when the cities get this money, we're supposed to be prepared, have shovel-ready projects, prepared to have the ask. And one of the biggest asks that's already on the table is that mental health crisis stabilization center, where they wanna do in Butler County, where they can have crisis people going there. It used to be just a 24 or 48 hour, but now they're trying to do it more, a longer stay, et cetera. So a lot of moving parts, but we wanna keep that on the forefront because we do have money that's
You know
there.
how much money you have? I mean, they've already told you.
Yes.
Yeah, it keeps changing, but it's like 54 million for
So-
Ohio,
Oh,
for
for
Ohio,
Ohio.
and then we were at, Butler County was,
So it's not, so it's dispersed in two ways. One is to cities directly, and it's a very small percentage that go directly to the cities. I believe Middletown's already
we've already
receiving
received that, yeah.
its annual allotment. It's
I
not
think it's like
much.
50,000 a year or
Yeah.
something like that for the cities. Over 18 years, we're thinking that the 18 years is purposely in there so companies can go bankrupt and not pay it all. You know, cause think about it, you have that out there, but they were saying, I don't know.
Well, I think the purpose is that you realize that the epidemic, if you will,
Not gonna be
is
over, yeah.
generational, and it's gonna last longer than
Absolutely.
right now, I guess. We're
I
trying to
can get
control
you-
our spending, but the minority of it goes directly to the cities, the rest of it goes to regions, so they predetermined, I can't remember how many regions, we are Region 14, which is not defined by county necessarily, it's multiple counties, and our region at least. And so that's where the most of the money is in these buckets in the regions. We're arguing that the opioid epidemic specifically hit Butler County significantly more than the other counties that are in our region. They're much more rural counties, and so it just didn't hit them like it has us. And so the problem being that now we only have one seat at this board within our region, and of course the board is wanting to equally disperse the money across all the counties in the region. Well, they barely had any, not barely, I don't wanna diminish, but we
Right.
just had a disproportionately high impact of the opioid epidemic. So most other counties, every other county in the state that had the impact that Butler County saw has its own region and is thus given a lot more money directly.
Mhm.
So we kinda got hosed on it.
Yeah, but it depends how you kind of look at things too, right? Because I agree with that. I think we need a little more power, but those smaller rural counties usually have the less resources. I mean, they have the least resources. And so that's what they're looking at too. So when they have, when you're like Jacksonville or Ross, or even Oxford, they have less resources than county seats, Hamilton, Middletown, those cities. And so sometimes they look at Butler County having.
We're not a county seat.
No, I said Hamilton City is a county seat.
Yeah, Hamilton,
Yeah,
yeah.
and so they, sometimes they look at it, you have more resources, and so they often feel as if Butler County is rich in resources. Not necessarily the money, but the resources, and so I think that's, and you've been at the table before with that mental health SAMHSA stuff, that's why it's hard to get grants often. We think we're being impacted really hard, but then they'll say, but look, they have all these other resources where sometimes those little one-horse towns have very little resources, so we're arguing for a little more leverage, but I think it may be in vain, but I will send that, I do have a sheet of paper out though, as far as the money, so I'll put that in the packet next
I may
budget
send
for
you the letter that all of the mayors signed.
I have that.
You have it. It may be worth sending it to the Board of Health,
Okay.
just because there's a lot of statistics within the letter. They put a lot of information together that you guys may be interested in reading about the impact.
Yeah, it was, Scott Rasmus, developed all those statistics, and we do have a strong case. We were hit very hard. Hamilton City hit very hard, Butler County in general, but.
Yeah.
And I think they were doing all that, Nicole, that makes sense. If you're in the head of the game and you're doing all that plotting in the head of the game, it's hard to change it once they finally get things written in stone, and I think we just didn't have the representation in the very beginning. That's how we got in trouble. Because when it came down, we're like, how did this happen? Because I think Stark County is by itself, right? I do believe Stark County is all by itself. And they're not as big as us, and they weren't. Yeah, Stark, yeah, look at the roof space, yeah, right, yeah, so. But I'll send that information out for you guys, it's good reading.
Yeah, I have it.
So
If you can't find it, let me know, I have it.
Okay, and I put that there, the letter. And other than that, we're still that Ohio is grant, and we talked a little bit about this, but that's that Middletown Connect grant. I have some information for you to see too, Nicole. But that is a grant that we are partnering with Safety Council and doing some social vulnerability index activities, and there'll be more to come with that, so I will put that in the packet, but that's where we're looking at baseline data, frontline primary data, how healthy is your community, and that is health on spiritual, mental, physical, financial, educational, economic health, and we're looking at all of those social determinants of health, and so. We just plotted some maps out for you, so I want you to have that packet. But that's, and everything else is on there. We're meeting with the ambassadors at the Nazarene Church on the 17th of this month. Ambassadors are part of that grant. We're continuing to find ambassadors within the communities to see what individuals are seeing, what residents are seeing, what they're wanting to see for their future communities. And we're gonna work closely with Alicia, and as she does the neighborhood stuff, so we're gonna try to make everything kind of make sense. Remember Alicia was doing the neighborhood, cookouts, the block parties? Yeah, for the neighborhoods.
Does
What do
she
you wanna see
actually
in
mean
your-
a block party?
No, that's why I told her she may wanna change that
I thought it was to
name.
focus block by block on
Yeah.
economic improvement.
Right, but she's calling it block party. I said, Alicia, don't use that because people think it's gonna be hot dogs and music. Yeah, because it's a block.
Yeah, it does kinda
So,
sound
but
like
it's a neighborhood, she wants to go neighborhood, block by block. What do you wanna see? What do you see? What do you see? Because we're finding that people don't look anymore. Remember you were saying that sometimes it gets so bad, you just take that exit and you just put your blinders on. So what do you see in your neighborhood? What do you wanna see in your neighborhood? How does that look? What do you need? Some of that. So we're trying to start mirroring some of our activities so we can make a great impact on our city, but the rest of
I
it is just.
anticipate, at some point within the next 4 months, I'm gonna give it a try. That we're gonna at least attempt to establish a neighborhood board or commission with the goal as a city council. So the goal being, I would like to just copy paste Hamilton's 17 Strong program essentially and put it into Middletown. So how do we, if you're not familiar with 17 Strong, if you look it up on the internet, you can find a lot of information, but they divided their city into 17 neighborhoods, and they have representation on a neighborhood committee that then reports to city council. So they've got structure, pride, organization in their neighborhoods, which can then play into all the different aspects of like health. First of all, we could have like the representative from some neighborhood, come join us at a Board of Health meeting and talk about what we can do with and for their neighborhood for health. Or community cleanup, of course, you can get your neighborhood together to actually get rid of some blight and hold each other accountable for code enforcement and talk about economic growth within your neighborhoods. So that is a goal. I know at least Zach and I are both on board with it. I haven't brought it up at council yet, so that would be my goal for this next meeting, that we discuss it as a council and perhaps even establish that board and then figure out how we get people on it.
Last but not least, you guys know that the churches came together. Shalom is back up and operating for the homeless initiative. The churches realize that a larger plan needs to happen cohesively, right? Comprehensive plan regarding the unhoused, and so hopefully they're gonna start that. Some of the citizens that were meeting before, when we talked about Dignity Bus and different option, tiny homes and all of that, so hopefully those groups will merge and we will come out with something that.
Every time you read in the paper, who the hell could, you can't even tell what they're talking
I
about.
know.
Every other day, there's
I
a
know,
different, they have a different thing. Oh,
I
it's
know.
a city, no, it's this.
I
it's-
know. I think, my suggestion for, this whole thing is really, government entities usually need to be out of this as they start the implementation for that faith-based group, because the faith-based group feel like, one, is their mission, two, they can get around certain things, and then city and agencies and businesses and citizens can come together with the gaps, if you will, or with the things that's necessary. So I think we're in line with that, and I think we just had a couple of hiccups. And not to put blame on it, because it's blame enough to go around for all of us, right? But I think it was COVID that stopped the activity in the first place. And sometimes, I've been telling a lot of groups, if you think what you do is important, find a way to do it, even in a pandemic. Because it's hard to have those stops and starts. And the doctor's offices stopped working, the hospitals stopped working, public health stopped working, fire, police. What you're doing is important, find a way to do it, because we're gonna continue to have challenges in our future that we're not gonna be able to operate as usual. And so I think we're prepared to do that. I also told the group when they said, so what about COVID? And I said, people are out in restaurants, they're eating, they're doing everything else. We should be able to house the homeless safely and find a way to do that too. And so we're working with them. Chandra went out and offered vaccinations. And so as we move forward, we're just gonna become better in all of those. But I think we can point fingers whose responsibility is. And that's the problem. When no one takes ownership of a problem, nothing happens. You know what I mean? So you have to, whose problem is it? Nobody wants it. Everybody has something to say about it, nobody wants it. So I think we're in a good place, and we'll just keep trying our best to assist them as we move forward with that, so. You have anything else to add? I think that's pretty
No,
much it.
we
It's
could
just
go
one
on
of
all
those,
day.
yeah, I know. So we'll try to be cleaner as far as our communication, but it was, I mean, I think what you read in the paper was what was happening, and it's what happens when you try to, collaborate and mix, and you have different personalities. Lord, have you ever worked with churches? I'm putting that on the record. I work with them, I put that all the time. I mean, I have my church all the time. I'm just on mute, because I would curse everybody out in 1 minute. So, I mean, it's just, sometimes it's very difficult. You have that passion, you have that, you know what I mean? It's just very.
There's also funding to
Well,
be
just as an
sought, which
outsider,
doesn't
just
help.
reading the
Right.
paper,
Yeah.
how many people get the paper, but reading it, I mean, every other day, they had a different, we're
Spend-
doing this, and then the next day or two, well, we're doing that, this isn't gonna do it, and then, you just can't even tell what they're doing.
You know what, and this is what made me feel better, it's a challenge, right? And this lady had this wonderful program, and it wasn't homeless, it was about a museum or whatever. She had this wonderful program, and she talked about all the moving parts, and then she finally said, and then 12 years later, we're opening. And so it makes you realize that most things do not happen overnight. You really have to get all those moving parts in line, and it looks differently along the way, but then you finally get your, so I think, like I said, I loved everybody that I worked with. It was great passion, it was great resources, and we just had to finally come to, literally come to Jesus. Is that another pun? We had to kind of come to that understanding that it's gotta get done, and we had to help the most vulnerable, so I think we're on the right track, so. That will to be continued. I don't think that's going away either, so. But that's my end of my report.
Thank you. Are you,
And that is Chandra. Chandra's medical director today.
Oh,
as
okay.
well as the nursing
Thank you
director.
for the pay increase. For the 2 minutes.
2-minute pay increase?
Yeah, so typically, Dr. Genowine will go over the disease report, in his medical director's report. And that's the, pretty graph that you guys get in your packet. So we, Butler County General Health District actually prepares the, epidemiological reporting, the statistical stuff. We contract with them through our, preparedness funds, so they prepare this. But that being said, I do see all of these cases come through our disease reporting. So for December, our COVID numbers were 377, which still sounds like a lot, but is down. So we'll take that as a win. We had 16 chlamydias, 4 gonorrheas. Unfortunately, we had 32 hospitalizations for influenza in the month of December. If you look, it's kind of on par with what the county and Hamilton is also seeing. It's high and it's early this year, so if you're not vaccinated and your loved ones aren't vaccinated, you may want to consider getting vaccinated. We had 1 case of aseptic meningitis, but I can tell you that aseptic meningitis was also related to our one varicella. Same person, so that's what caused it. So that's it for our communicable diseases, and we didn't have any HIV cases this month to report, which is a good thing.
That trend was going off the charts last year, right? Yeah. Okay. Do you, does that cover nursing as well, or was that just the,
Yeah, nursing basically is just that we're continuing to do our, COVID vaccines on the 1st and 3rd, Thursdays of every month, as the, need warrants. We'll make any changes if we start seeing those numbers decrease significantly. And we are still offering flu vaccine. That pretty much covers nursing too.
would you mind touching on the syringe exchange real quickly, because the
Yeah.
stats are in here and we haven't really talked about it yet at this meeting, but it is kind of an underlying, ongoing.
Yes,
piece.
our harm reduction initiative is our syringe exchange, which, and we talked a little bit about this, where we do HIV testing, hepatitis C testing, exchange clean needles and paraphernalia, and give education as far as, and resources. We have been known to take people to treatment. QRT, the quick response team within the city, works well with them, and our agencies work well. Is right now in the Access Counseling parking lot on Cincinnati-Dayton Road. If we were to look for another location, we have changed locations a couple of times. In the beginning, it was on Crawford Street, and that's because we saw a lot of overdoses and deaths there, so we put it right in the middle of where we were seeing things. And then we moved it from there to the Gathering, I think, for just a second. It was like there for how long? Maybe, Nicole, 3 months or something? It wasn't long that it was.
A year or more.
And then we moved it out on Cincinnati Dayton Road in the parking lot towards the very back. It is there only on Tuesdays from 10 to 1. And we're looking maybe for another place. Access Counseling said they do not want to keep it there. They'll keep it there as long as they can, but as long as we need to find another spot. And we were just kind of in the flux saying, did we want to keep it? Or
Right.
did we want to let it go? Hamilton, the new health commissioner, Eric Balster, is the health commissioner for Butler County. He's new, and he's been trying to work on Josh Smith and people in Hamilton. That's where a lot of the overdoses and the deaths and even the exchange stuff, we get a lot of Hamiltonians come, and they would love to maybe do it in their parking lot 1 day a week or whatever. They're trying to get that done, but Hamilton has been very resistant, they always have been. And it's another location in Fairfield, and I think Oxford just agreed to have a location. And so, to be continued. It is controversial, as we talked about, but it is very needed. And when we had that HIV outbreak, and it was actually in 21, because in 2022, our cases were down last year. Remember, it was 2021, I think, wasn't it? That we had that big explosive. And I talked to them about this too. We found that cluster of people that you can get. And so this disease, bloodborne mobile unit, that's how it went through the Senate bill to be able to have these in your community is really important, because that's how you find people, and that's how you kind of track, and do strong outreach. And every time we had our Hep A outbreak, that was the population we vaccinated. I mean, so it's certain populations that if you're gonna look for things that are spread easily through blood transmission, et cetera, or sexual intercourse, whatever, if you have a population identified already and you can get there, you can stop the spread before it gets in the community. Because it ultimately will get to all of us if, by other means or whatever, when you have a. So is there anything else? I mean,
There's an option with the syringe exchange as well, whether you go to 1-to-1.
Right.
2-to-1. Right now, we don't have a restriction. I think they
Right.
give a whole bag out even if you return one needle.
Right, and the
or no
1-to-one,
needles.
correct, yeah, I know. So the 1-to-1 is
I'm
the way
just-
you would love to do it, cause like, you give me one of your
Yeah.
dirty and I get you one of my clean, but CDC, and it says, sometimes, and Ruth could speak on this, you give to the need. And if you know you have a strongly addicted person, especially if you know that person has HIV, they're gonna use more than one needle. Now, the 1-to-1 works well in large cities that have needle exchange open daily. But when you only have a needle exchange in your community 1 day a week for 2 hours, you have to give enough of the supply that it can be safe use, right? And so that's where it gets those caveats come in there. If we were
Presuming that
giving-
the used needles end up where?
Used needles usually end up in Sharps containers. I'm just kidding.
Uh-huh.
Yeah, right. No, used needles usually end up in your environment. Now, when we can start really trying to tighten up on all of that again and go out, because when we first started this, we had clean environment. I mean, when we did our cleanups, everybody was so excited because we found no needles. But then as you go along now, we're finding needles again, so.
I'm
Yeah.
definitely seeing them again.
Yeah, and you're seeing a lot of it too. And you guys, needles are usually found where it's high use areas, where the people are using it too, or who's paying attention. I don't think I've seen needles around my house, but I'm not really looking down. I mean, you know what I mean, how you have to look, I'm not in the parks or whatever, I'm not taking that walk.
I'm in the homeless walk, that's where I live.
I know.
I
Well,
see it all the time.
yeah, that area. So anyway, to be continued with that, I have told them, I have a meeting coming up this week, I have told them that they really need to start going back to that restriction again, but that's the reason why you usually get 40 instead of 1-to-1, because you're trying to make sure they have enough to use, that clean use between the next week.
There are some individuals who come in to get needles for their entire household too.
Right.
Some people are afraid to interact at these places, they think it's a trap, so they'll send one person in, yeah. When
Mhm.
legally, actually, a police officer cannot be within a certain, distance of the, exchange. Yeah.
Because, and that whole paraphernalia law, because they try to give out clean use use, because your, what do you call it, tourniquet can carry HIV and, Hep C more so, Hep C, and your cooker, and so they try to give clean tools, right, and materials, that's in our contract too, and a lot of people get really.
Well, like, they will hand out fentanyl test strips, so those are illegal, you can't even have those on
Right.
yourself, but they're giving them out, so there's a.
Right.
So, I could have a test strip on me just to give to somebody, but if a cop pulled me over and found it on me, I have drug paraphernalia on me.
They were
But yeah,
trying
we're
to,
giving it too, it's, yeah.
they were trying to change that law too,
Confusing.
remember? I think,
Yes.
yeah, they were
Yeah.
trying to change that law too. It's very, don't get me wrong, everybody, I think, is very controversial, right? It's not an easy topic at all. But we have to get to the point, what are we trying to do? And I don't know, I definitely don't agree with it causes more use. I do
Yeah,
think
they're
it's
gonna use-
safer, but then I always had that issue with our syringe exchange, what else are we gonna do next, right? So I always said, after the exchange, how are we reaching out after the exchange instead of just having one location to exchange? Let's make sure that you're gonna start doing something about your addiction and stuff, and so it's supposed to be getting better. It's a big harm reduction committee.
That's what I'm gonna say, how's that working out?
Yeah, it's just, you just can't be in all the places, you're like squirrel. And it's a big harm reduction committee that they're trying to work on all the above, stigma. I always say, you guys.
I'm a fan of trying to do prevention.
Yeah, me too, prevention.
Let's just stop needing the needles.
Right,
but
there you go.
it's a
That's
very
what we
ideal
should do.
situation, ideal world.
A lot of schools, all the schools, had Narcan, like the high schools, they had Narcan in it, they agreed to it, because we also were able to say, there are a lot of people on oxycodone and opiates in general, Darvocets, Percocets, things that are, you know, they're just not heroin, but they're the exact same thing that they could have an overdose or kids could get to. And so most of the schools do have it, the nurses agreed to, have it, coaches are, able to administer Narcan, we trained them or whatever, so it's just on that far case that if you had to. Some schools, and it wasn't ours, but some schools, they had parents that had overdosed while they're waiting for their kids. So, I mean, yeah. So those are, I mean, that's, I know it's terrible, that's reality. And, some places, they teach the kids how to use Narcan because that's who they're finding, their parents overdosed. And so that's the sad, sad truth, but they know it better than, sometimes we know it, the kids. You know, when we always say, let's protect the kids.
You wouldn't believe what they see.
They see-
Yeah.
I told you it's like that show where they said, my kid doesn't know where my gun is, and then they go in there and say, where's the gun? And they pull the stool out and they get on the chair and they get the, they've been watching you all along. You know, it's kind of hard to hide things from kids. They're quicker, smarter. So, yeah, to be continued.
I haven't been to the syringe exchange. We can go.
Yeah.
We can just go and see, right?
Yeah,
I
I
may
can
go
tell
on
them,
Tuesday.
I can tell them that we've had people that go out. I can tell them, it's nice to give them a heads up so they won't say who's out here, but they'll show you the operation. You can stand there and watch. You can just, talk to the people or whatever. They try to, really and truly, they try to be respectful of the clients, right? Because the clients, they don't want them to feel like they're being harassed, even when drug people, what do you call them? Agencies that wanna come out there. Treatment centers or whatever, they
Yeah,
always
won't-
say, try to stay,
They won't
yeah.
let me, come out there, well, I mean, I could
See
show up,
that?
it's not like they're gonna turn me away. They don't want me to have my badge on,
I
or
wouldn't
anything
want
like
them to
that,
be
but
uncomfortable.
at
Yeah.
the same
Okay.
Yeah.
time, my agency gives, bags of
Food.
non-perishable food items,
Mhm.
and they're gonna be sitting right there with our
Card on it.
logo on
The
them and
goal is
everything.
to get them
but-
into treatment. I mean,
It's-
ultimately, right?
Yeah.
Yeah.
And then-
Wraparound
and then,
services
like-
get out of the loop.
One of our offices hosts a county's exchange program in our office.
Mhm.
It just depends on who's running it.
Right,
So,
right.
I could go there as a member of the Board of Health, but I cannot go there as
A treatment.
outreach from Sunrise Treatment
Yeah.
Center.
You're not supposed to harass them. You're not supposed to harass them.
That's
But
not
that's
harassing,
like-
that's like trying
I
to
know.
get them out of this
Me personally-
terrible life
Yeah, I know.
situation.
I know.
Me personally, the reason I support an exchange is because of the connection to treatment
Mhm.
and
Right, but
the-
if we're
the
not
communicable
allowing.
diseases. I'm not a fan of giving out needles.
So if we're
I'm
not
gonna put that on the
allowing
record,
treatment
but-
services to go there, then
You're not allowing
I didn't
them to
know
be
that that was the
harassed by
case.
the treatment.
Yeah, I
providers.
think what they could do, cause churches are the same way, faith-based churches, we don't want them over there, can I pray for you, brother and sister, cause it's the same thing, but you can be there and you can offer your stuff, but you can't say,
would you like to go into
That's all,
treatment?
yeah.
You can't say that?
no, you
I
have to be
mean,
present.
then what are we doing?
The QRT team, the people on the team that has the people on the team that already have the relationship are saying, are you ready for treatment? Hi, how are you, Ruth? Because they have a relationship. But then other people, because people wanna get there and sometimes get you in treatment, cause you can build. I mean, you can start, you can really, what is that word? You can, start.
Monetize it.
Yeah.
Yeah.
Yeah, and so that's what they don't want. It's a slippery slope. Now, we pass out stuff, we give out stuff, everything on the van. When I say we, it's the whole county thing. They have all their brochures, they have all their pamphlets, and they talk to them about it, and they say, do you want treatment? If it's a pregnant woman, they give them sojourners, they talk to them really, and they'll call, they'll get them in there. But it's almost like if you start scaring them away, then they may not come. And so that's why it's that, well, yeah. It's hard. It's hard. It's like we have
I
teenagers.
wanna go on Tuesday.
You wanna go
Okay.
Tuesday?
Yeah.
You wanna do This today?
This
10 o'clock?
today?
Not today. I have meetings today, next Tuesday.
Okay.
I put
I'll
on my
tell 'em.
calendar already, next Tuesday.
I'll tell 'em. Yeah, she'll
I
be there.
just did a drive with the police. That was very interesting. They know where the homeless are, they know what their needs are. When I was driving with them, they have a care coordinator walking with them. They do it 2 or 3 times a week. And they drive around to all the camps. They know where the homeless are. And they found out that one person got back onto drugs, which had been in treatment and stopped. And they knew where he would be. And they went there and they picked him up and they convinced him to go back into treatment, and he did, and we drove him to a place in Hamilton that's a treatment center. They're very, very helpful people.
So that is happening because of twofold. One, the city has a contract with One City for Recovery. So that's Victoria is going out with
That's who.
yeah,
Victoria?
with the police department's community-oriented policing group. So we've got 2 police officers who are part of the community-oriented policing with attempts to make inroads with the community and stop crime and things before they happen, right? So that's kind of the mission of the COP unit. So we have 2 officers that go out, I think, twice a week as part of the COP duties. And so they link up with Victoria and go do all these things at least twice a week. They're out there doing
I
this.
was very impressed.
And you got to join their efforts that day.
And everybody's welcome to do that as well. I mean, Dave Burke, Chief Burke,
And I would
always.
recommend that everybody do a drive along at some point in time. It's really, you get a whole different picture of your community.
Right. And I think, it's just like church. I always tell people, it's just like church. You have to just keep getting one person at a time fishing. It's because it's no, that, it's just no one way or one right way to do anything. And when people, this always bothers me, and I know what people mean by this, but everybody doesn't want help. I think everybody wants help. It's just when they grab it. Because all of us that no one wants to be blank. But you just gotta get to that point where you're ready to grab that help or make that change or do things. And you just can't give up on people. You never know when that happens, and you never know what you do in the scheme of things that cause that to happen. It's just the things that you talk about that kind of spark to that whole thing. So last but not least, the homeless walk. They do it every year, and they do the homeless count January 25th. They're looking for volunteers, and I can put that information, I get that information out to you guys, but we were just at a meeting last week where January 25th, they always say, you can bet on it, it's the coldest day of the year, and then they don't get a great count because everybody's in somewhere, right? But they usually they know where all the camps are too, and they put this number, they do this across
What do they need
the
help
county.
with?
Volunteering, going out and counting underneath the
Who is
bridges,
they?
and it's the Homeless Coalition. That would be, I think Mindy Mueller might be over that too. So
if
I
we wanna
can get you,
volunteer,
I can
I'm
give you that
available, I'll
information,
kick
yep.
in.
Yeah, and you're walking over, and I think Dave Burke said they get with the police too, so they make sure that those volunteers are safe. They go underneath the bridges, they wanna see who's out, so they go to all the camps. And so they said, if you want information, contact me. So that's what she said in the meeting, so I'll get that information out. I don't have the information, but I know it's January 25th. Be something maybe fun to do one time in your life, just to kind of see how that looks. And they go out and they do outreach at that night too, to say, do you need help? Do you wanna go in somewhere? Do you wanna get? But I'll send that out to the board. I have all this out there.
I was kind of amazed at the young age of these kids that are out there homeless.
we call them
Yeah.
unhoused.
Yeah, yeah.
Because it's not
Unhoused.
necessarily that they don't have a home, they're
Yes.
choosing to, in many cases.
Yes,
Mhm,
many
mhm.
cases it's family oriented.
Mhm.
Well, I know Carla's been chomping at the bit to
Bits.
get our environmental, so
Oh,
maybe we
yeah.
should move on to that.
Oh, we're not done?
No,
One more report.
I'll make it quick. We license, Phoenix Metals, a micro market inside Phoenix Metals. That's on,
The new,
Phoenix.
in the Maid Industrial Park?
Yes,
Okay.
yes, there's a micro market in there, which is really just like a self-service convenience store, what it is. Kroger, approved plans for a Kroger addition. I think they have an additional one at Town Boulevard.
Oh, the
Well,
other
the
one is
other
not
one-
technically in
That's
Middletown,
Butler
is it?
County, right,
Oh,
Butler
okay.
Township's Butler County. So we approved the plans for their addition, and Marshall High School is having a culinary, school inside, so we approved the culinary kitchen inside Marshall High School.
That's
Um,
out by like Tractor Supply, Dairy Queen,
Yeah.
that
Yes, Dairy
facility?
Queen, yep.
Okay.
Yep. Also, we, still have 3 septic systems that, on Jefferson that have not been connected to sewers. Back in June, we, refiled, so we're waiting to hear from the prosecutor's office, so I'm not sure what's going on there, but we've touched base with them a couple of times since June, so we're waiting for them to file the.
And the rule there is when sewers are available, you must connect, and those are what she's talking about, those houses did not. And so you have to take them to court.
Yep. So 3 left. Hopefully we'll get through that. And right now, our licensing year is ending in March for the food service, so we're, just working. We shouldn't have any problems getting our inspections done. We're close to being finished with that.
Did I see that we did not do any, food service operator
We did not.
classes? Is that just because there was no demand?
No demand.
I
but,
thought everyone had to have one
they-
person on site that's certified.
They do. They
But
do.
They do
But
it
we did-
online.
They
right?
can do it online as well.
That's probably what's
Yeah.
happening.
So I went to the Department of Health's website to see, like, if you wanna, like, even apply for a food service operator license, and then if you needed the certification or whatever, how do you do it? I couldn't find a link for the online. All it eventually brought me back to was your name and email.
Mhm.
I didn't see
On
the
our
online link.
website?
Yeah, I couldn't find it. Now, maybe I didn't, but I'm just, if I like
You
am
couldn't
searching
find the
and couldn't
application?
find, I
The
couldn't find any
class.
applications and I couldn't find a
Oh.
link to the online class. So it was very not clear to me how you go about the process. For what it's worth,
Yeah,
it
that's
may
good.
be
That's good to
there
know.
as just as an end user, I couldn't find it.
Okay.
So we may wanna,
Look at it, yeah.
Yeah.
And usually we'll send those out a couple of times, just offering the link. We send them out in the licenses. Our licenses, we send those out in February,
got it, to the people who don't.
January. So we'll send them out and
Sure.
we'll kind of work on that this year, trying to offer those. But a lot of facilities are short-staffed still, and so if they do
They're
it, they'll try
probably
to do
doing
it
all the
online.
online, yeah, okay.
So, but we'll still continue to reach out and try to get that taken care of. Other than that, that's pretty much it.
And when we have bad inspections, then we'll say,
You
you
have
need
to
to
do-
have your staff, and we'll come in and do it, you know what I mean, we'll do it at one time, and that we'll,
Yeah,
so
we
that
saw that.
is something that we really press them to do with us, so that we know we can get it done and get everybody kinda done, make it convenient for them, and get everything done at one time.
Oh, one other thing, we did do a walkthrough at Primo, I wanna say Primo, last week, so, there were just a couple they have to submit plans to us, but other than that, we identified some areas where they may need to address, but, other than that, hopefully, they're actually out of the country now. So hopefully they'll get that to us in time, so we can make sure that they get their license and get open.
Yeah, cause
They
I think
do.
if we're looking at 3 weeks, maybe 4 weeks,
Yeah.
Yeah,
before
they were wanting to open
Yeah.
in first week in February.
yeah, they got a
I
lot of
know,
work to do.
I know, yeah.
Anyway, well, we all know how timelines go.
Yeah, they can get it done, but they got a lot of work to do, but we still don't even have their plans in, they need to get the plans in.
But they're taking reservations.
But they're taking.
That's why, I'm like, wait a minute, I thought I just saw what they were saying.
Yeah, they're
Okay.
nowhere near
Okay.
done, but.
It might be free that night.
So I don't need to hold off on my reservation.
I mean, it might be free that night, you can't sell food without, but you can certainly serve it.
And is
No, I'm
there,
just kidding.
have you heard of any plans for anyone to go into Mockingbird's space, cause
We
they're
just-
moving?
Yeah, we just saw that online, so nothing.
Okay.
Nothing at all. We're also working with this, gentleman, on Vail, old UDF. There's a language barrier with him, so we're really working with him, cause I think it's gonna be a Spanish grocery store.
Oh,
Vail.
yes,
On Vail,
Yeah, on Vail.
right there remember where the old
behind
UDF?
Rogers, Flower by.
Yeah.
Yeah.
Mhm, Flower by Rogers right there.
Super bright,
Really?
like, super bright.
Yeah.
Mhm.
Like, you can't miss that at night. You're like, what is
Oh,
going on
really?
there? Yeah,
Yeah.
okay.
So we're trying to work with him, and he's working upstairs, with the new development,
Yeah, David?
I think the there's a lady up there that speaks Spanish, but yeah, so.
Oh,
we
with
have-
SBDC.
Yeah, so
Yes.
it's a little difficult, but we're trying to get him open as well, so.
There's gotta be somebody who speaks
Yeah. So, but otherwise, that's it, we're just chomping at the bit, trying to complete inspections, but we're good.
Anything else anyone wants to add before we adjourn till February?
This is a longer than normal meeting.
I don't know, we often finish around
Oh, like 9 o'clock? Uh-oh. She said we all.
The real truth, huh?
Yeah. I suckered you in. I said, oh, we usually finish in 20 minutes. I didn't say 20.
Oh my God, Jackie.
No, but welcome.
But
I'm
it's good,
excited.
I want people to bring topics up because we can do more than just approve, you know, whatever these guys bring, like we can be proactive in the community, so.
Yeah, especially.
Well, with that, we will adjourn the Board of Health meeting officially until February 14th. Oh, Valentine's Day. We'll start our Valentine's Day together, guys, 7:30 in the
I know.
morning.
I heard somebody's birthday is Friday or something. Did you hear that?